name is Claudine Mujawamaliya. My job title is Community Health Worker. I work with the Strong Beginning based on Kent County Health Department. My job is to visit women, pregnant women and their babies, to give them support and try to help them a little bit with the stress, or like give them a resource, like help them find a resource. And sometimes they don't even want much, but they want somebody to talk to or to encourage them. I work with most refugees, those refugees who was immigrant, who was in they are Congolese, but they are in the camp in Rwanda. They are those women who speak Kinyarwanda. I love helping, like, not say I'm a fixer, but I like to feel like I help somebody. So when I came here, I worked mostly in the nursing home, and I loved it. I loved it. Where I worked in rehab mostly my years, like I loved to see somebody came their worst, and I was able, maybe not much, but to give them like a lift up. If you have somebody in the corner who tells you, you can do it, you know, like listen to you and believe you. Then I was working with women from Twitter. So I ended up doing translating too. So when I was translating for the nurses from Kent County Health Department, going to visit those women in the house, so I started translating for them. And the nurses, they are like, you are really, really good at this. They have opening, like community health worker opening job, and it can count, would you be interested? I'm like, working with babies every day and pregnant women? Of course. I got hired and I got to get my license. For the CHW Community Health Worker Certificate, it wasn't that bad. I was still working. But on Tuesday, we'll have like classes all day. And then every Tuesday for 3 months. And it wasn't bad. It was actually easy. I was so nervous, but they make it so easy and they work with you. And if you have a question, there's a lot of group of people you can call, and you have their phone number, you have their email. If you have a question, you ask them, and if you can do the homework or if you can do the assignment, they're not gonna call you out. You tell them, they work with you. They're not trying to fail you. They're trying for you to success. So they work very hard for you to be success, not just fail you. Healthcare, it does not have to be in nursing, or it has to be with needle blood and all that stuff. No, there's more around there. And trust me, I did not figure it out until 1 year ago either. So community health worker is like a range of a lot of things. Like you can work with insurance, you can work with the rehab for a lot of people. So you can work at like a lot of places, even if you don't want to work with the women and the babies. But there's the other way you can work with the communities. Like it's big. It's really big. And actually I didn't know that. I thought it was just like you work a community health worker when you work with the women, until I started my community health worker course. It's a lot of places you can work as a community health worker. It's depending what you're passionate. It's always like you're gonna be a nurse. That was the thing. That's what was expectation. So I'm like, I do still want to work with people, but I really don't want to deal with medication, and I don't want to deal with the needles, but I really, really, really love working with people. So you have to figure out, what do you really do? If you really, really want to work with people, there's a variety of like places you can work and things you can work. And I work every day with the women and the babies. That's the best part.